as a parent. And when I think about it in that regard, I think first of all about the cost of COVID for our kids and for my kids. I have a 5-year-old son and I have a 3.5-year-old daughter. So my son is now eligible to get vaccinated. And when I look at the toll on our kids of having to go through this pandemic over the last almost 2 years, it's really substantial. They're missed opportunities they've had to be with family and friends. School has been interrupted. Youth sports have been difficult. And of course, there's a health impact too. And what Dr. Wen mentioned was so important. The numbers helping people understand just how consequential COVID has been for our children. There is a myth out there, I read, that COVID doesn't really bother kids. It's not a problem in kids. What is true is that COVID is, we our kids do much better with COVID-19 than older adults. And thank goodness they do much better. But it's a far cry from saying that COVID is harmless in children because it's not. And if you talk to any of the parents of the thousands of children who have been hospitalized, they would certainly reaffirm that and tell you that's the case. So, look, as a parent, first and foremost, I want to make sure that my child, that all children have protection against the vaccine. Well, I mean, against COVID-19. What I want to make sure, though, is that the vaccine is both effective at preventing COVID and that it's safe also for my child. And I think most parents want to know that. And that's why I've been really encouraged by what the FDA and the CDC found in their review, which is that the vaccine in kids 5 through 11 was more than 90% effective at preventing symptomatic coronavirus infections. That's great news. But what they also found, which is equally as important, was that the vaccine had a strong safety profile. The side effects they did see in children were mild side effects that included things like soreness and pain at the injection site, a headache, fatigue, and a small number of cases, a fever. But here's the important thing. These symptoms lasted for a day or two, and then they went away, leaving children with protection against COVID-19. And they did not see serious adverse events occur with children during these clinical trials. That was really, really good news. So all of that data together is what made me and my wife, Alice, feel good about getting our 5-year-old vaccinated. And so we plan to do that as soon as possible.